Hello everybody, this is Kazuhiko Tanaka, the ITU Association Japan. We have an ITU event here in Tokyo. We will report by video. It's an e-health workshop and focus group on disaster relief systems, network resilience recovery. Please enjoy the video.
I'm very honored to host this important and meaningful conference here in Tokyo. Almost 2 years have passed since the Great East Japan earthquake. Although there are many difficulties remaining, of course, the lifelines of electricity and water, as well as transportation and communications networks, have mostly recovered.
For this opportunity to look at how we can work together to achieve the goal of advancing e-health standards and identifying future needs, tools, and responsibilities for the stakeholders, which are based on the requirements of e-health implementation in low-resource setting.
ICT が根源的に有する時間と距離を超越するとともに、情報共有を促進する機能を最大限活用して、医療分野の課題の解決に取り組もうというふうに考えております。
So I think, in essence, this is a fact. Accident always happens in the past and in the future. If you don't like to see it, but it's happened. Accidents happen. Machine breaks, you know that.
The most impressive thing is information sharing as regards on how we need to use the mobile cellular phones in health sector, for instance the hospital, the clinics, so that we can have the data and also consistency in terms of medical consultations, diagnosis, and so on and so forth. So most impressive. Who knew about the Fukushima disaster, that it was going to take place? Nobody knew that it can take place. So disasters, we cannot prepare for them. We cannot predict. They can happen anytime. So before this can happen, maybe we need to prepare ourselves, and Japan can assist us to prepare ourselves by providing the technical know-how, by probably opening an industry within Zambia where people can begin to access these from their technology, because they've moved ahead of us. And I can just appeal that they can focus their attention on Zambia.
What do you think about this conference? It was a very great conference and we have learned a lot of things and we hope to implement e-health in our country. In fact, before I came to this conference, I don't know about ITU, so I have learned a lot of things and I think it's a very good meeting. I think it was very useful, all what we have listened today. Very, very useful for us.
Yeah, and I enjoy. It was very interesting. Yes, it is our hub. We need to collaborate with ITU for improve health in Algeria. In Algeria, health is in the beginning. We haven't all institution for this. We hope that the ITU Japanese organization help us for introduce and approve it in Algeria.
It's very exciting and gives me lots of new insights.
What do you expect from e-health for saving medical treatment problem?
Yes, I think for our country, electronic health is very, essential. I think because my country is about 676,000 kilometers square in areas, so it is a large country, and 70% of people lives in rural areas. So there is a problem in giving medical care. The one thing is because of healthcare delivery system to the remote areas. So if we can implement the electronic health system and telemedicine, it will be helpful for the people from remote areas.
So by doctors or by patients?
Both, yes. So only when the patients are safe, doctors will be joyful. For me, it's very impressive, and I'm very, very much obliged for inviting me to this very impressive conference.
It is the first time we are attending this conference in e-health, and we would want to take the message back because we have looked around, we have listened, and we've learned, and we believe that there are very high potentials of implementing e-health programs in the Republic of South Sudan, in spite of all the challenges that we face as a very young nation. The most impressive thing that I learned is the innovation of the Japanese people in trying to develop means for solving problems of humanity is very impressive to me. We need continuous support from the Japanese people, particularly in the development of the capacity of our young people, so that we can catch up with at least much of the common knowledge and technology that is available in this country. I also want to take this opportunity to say that Japanese investors must come to the Republic of South Sudan. It's a young nation. We'll begin from zero with them and will make a big difference with them. I know that the government of Japan is making great contribution today in the development of our infrastructure that was either destroyed or not there at all, and also in the building of the capacity of our young people in vocational training. There are very many great things that the government of Japan is already doing in the Republic of South Sudan, and this is one of them, and we're very happy to be part of it.
About this conference?
The conference is very useful. I think that information in the conference cover a wide range interest for it is useful for the not only the health sector but also the operators like us. E-health can resolve or at least take part in resolving the medicine problem from many aspects. It can support or help people in the remote areas to approach the knowledge of the medicine. It can also propagate the information to the whole communities, and I think we can consider it from many other aspects. Good question. We not only like or want to cooperate with the Japanese company, we are doing so. VNPT and NTT has a long history of cooperation. We in Hanoi has a BCC project with the NTT East for 15 years, and we are preparing for another project for another 15 years. We are not cooperating not only in the infrastructure field like FTTH. We are also cooperating with NTT, specifically NTT Communications in the field of data center. We are now operating a NTT Com's Wind data center in Hanoi. And VNPT also is cooperating with NTT Data in value-added service for mobiles. And I think many other things.
So many projects.
Yes, many fields, many projects, I think. Yeah.
The main purpose of this workshop is to provide a place to discuss and also collect expertise, including the experience from the field, including non-members. In general, ITU meetings are operated based on the membership system, which means only members could attend the ITU meeting. But workshop is open to non-members so that we could collect a wide range of expertise, including from non-members as well. And since e-health is a new area and which includes the areas which are not related to telecommunications, so it's very important to include experts from non-members as well. Important point is the standardization activities doesn't create benefit instantly. So in many cases, if there's an economical difficulty, standards section could be shrunk or even deleted completely. And this happens not only in Japan, but in many countries it happens. But in the long term, standards is the most important way to make it efficient and economical. So I hope Japan could continue its good contribution, which is done currently. Concerning the e-health workshop, I think this the result of this workshop set a very good starting point to progress the work on e-health. And actually, it was pointed out that e-health includes a lot of organizations, not only ITU, but also the WHO, of course, and also there are a lot of alliances which are related to e-health. And this workshop already invited a lot of non-members, a wide range of people, and also from many countries. I think important thing is to involve all the stakeholders in one place so that we can share the same idea. Also, they understand the need from other stakeholders like doctors, other organizations of the other governmental organizations, and also manufacturers. Especially, I think it's very important to include doctors who practices actually in the field, and also who uses the e-health. On the other end, we need to listen to the voice from the patients, who should receive most benefit from e-health. So important thing is collect all the opinions and integrate into a good e-health system so that people could use and benefit, and so that doctors could work efficiently, patients could benefit from the e-health. So e-health needs to be shouldn't be not very cheap, but should be reasonable price. Fundamental theme of this workshop is the e-health in low resource setting, because in developing countries, resource could be very limited. So it's very important to build up the system with low cost, low resource, and that leads to make it environmentally friendly as well. So I think this is one of the most important priorities.